If you've been taking a magnesium supplement for your leg cramps and it isn't working, I want you to go check the bottle right now. I'll wait. Look at the label. Find the word after magnesium. Oxide? Citrate? Glycinate? That single word may be the entire reason it hasn't worked, because there isn't just one magnesium mistake. There are three. And most people over 60 who have tried magnesium for their leg cramps without success have made at least one of them often without ever knowing it. Today, I'm going to show you all three. The form on the label that is barely absorbed at all. The medication that quietly cancels out the magnesium you're taking no matter how much you take. And the timing mistake that wastes a portion of every single dose. By the end of this video, you'll know exactly what to look for the next time you're standing in the supplement aisle or the next time you open the bottle that's already in your cabinet. I want to tell you about a patient I'll call Ruth. She was 73. For almost a year, she had been taking a magnesium supplement every night specifically for her leg cramps, the same large bottle from the pharmacy. The cheapest one, 4 tablets a day, exactly as the label suggested, taken right at bedtime, along with the calcium tablet her doctor had recommended years earlier for bone health. Her cramps barely changed. She had told 2 different people, a pharmacist and a friend who'd recommended it, that she was doing everything right. She was taking it every day. She wasn't missing doses. And nothing was improving. When we looked closely at what Ruth was actually taking, 3 things stood out immediately. And none of them had anything to do with her discipline or effort. All 3 were sitting quietly in the details, the kind of details a label doesn't make obvious, and a pharmacy shelf doesn't sort by. Stay with me. Because what was true for Ruth is true for a significant number of people who believe magnesium just doesn't work for them. Mistake number 1 is the most common of the 3, and it is sitting on pharmacy shelves everywhere. Usually in the largest, cheapest bottle on the row. It's the one Ruth had been taking for almost a year. Magnesium supplements are not one thing. They are a family of compounds magnesium bound to different carrier molecules, and the carrier determines how much of that magnesium your body can actually absorb and use. The cheapest and most widely sold form is magnesium oxide. It dominates drugstore shelves because it's inexpensive to manufacture, and the label can advertise a very high number of milligrams per tablet. But that high number is misleading. Research comparing magnesium bioavailability has found that magnesium glycinate is absorbed at roughly 23.5% compared to roughly 11.5% for magnesium oxide. Less than half. A 500 milligram oxide tablet may be delivering a genuinely small fraction of usable magnesium to the tissues that actually need it, including the muscles in your legs. Worse, magnesium oxide has a well-documented laxative effect at the doses many people take for cramping. The poorly absorbed magnesium pulls water into the bowel, and at higher doses, this is uncomfortable enough that people either reduce their dose on their own or stop taking it altogether right around the time they'd need a higher dose to see any benefit for their muscles. The forms with meaningfully better absorption are magnesium glycinate and magnesium citrate. Glycinate is chelated bound to the amino acid glycine, which allows it to be absorbed through a different intestinal pathway that largely avoids the laxative effect. It is widely considered the better choice for nightly, ongoing use, specifically for muscle cramping and sleep, because it doesn't force a trade-off between dose and tolerability. Citrate is also well absorbed and is a reasonable choice, particularly for anyone who also experiences occasional constipation, since it carries a mild, useful osmotic effect at higher doses. Ruth had been taking magnesium oxide every night for nearly a year, 4 tablets a day, exactly as instructed. Her actual absorbed magnesium intake had likely been a small fraction of what the label implied. Mistake number 2 is the one that explains why some people switch to a better form of magnesium and still don't improve. Because for them, the problem was never really about the supplement at all. It was about a medication quietly working against it, one of the most commonly prescribed medications in the world. Proton pump inhibitors medications like omeprazole, esomeprazole, and pantoprazole, prescribed for acid reflux and taken by a very large number of people, over 60 reduce stomach acid as their primary mechanism. That's the intended effect, and for many people it's the right medication. But your intestines rely on a degree of normal acidity to absorb magnesium efficiently. Specifically, magnesium absorption depends on transport channels in the gut wall called TRPM6 and TRPM7, which function best in an acidic environment. When a proton pump inhibitor raises the pH throughout the digestive tract for months or years, those channels become less effective and magnesium absorption drops, regardless of how much magnesium you're taking in or what form it's in. The FDA issued a formal drug safety communication on this in 2011, specifically warning that long-term PPI use, generally a year or more, can lead to low magnesium levels associated with muscle spasms, leg cramps, irregular heart rhythms, and in severe cases, seizures. Here's what makes this mistake especially easy to miss. Your body stores the large majority of its magnesium in bone and tissue, not in the bloodstream. A standard blood magnesium test can come back looking normal for months, sometimes years, while your total body magnesium stores are quietly declining underneath that number. Researchers note that this is exactly why PPI-related magnesium depletion is so often missed. The test that would catch it isn't sensitive enough to catch it early. And the risk compounds in a way that connects directly to an earlier video in this series. The FDA warning specifically notes that the risk is significantly higher in people taking a PPI together with a diuretic, because diuretics deplete magnesium through the kidneys at the same time the PPI is blocking its absorption in the gut. Two separate mechanisms working against the same mineral at the same time. Please do not stop a pee without speaking to your doctor. For many people, it is genuinely necessary. But if you have taken one for a year or more, and especially if you also take a diuretic, ask your doctor specifically whether your magnesium level should be checked and whether a glycinate or citrate supplement makes sense alongside your medication. Ruth, it turned out, had been on a PPI for acid reflux for 6 years. Nobody had ever connected that medication to the cramps she'd been trying to fix with a supplement the entire time. The third mistake is the smallest of the three, and the easiest to fix. It has nothing to do with which bottle you buy or what medication you take. It's entirely about when you take what's already in your hand. And it turned out to be the very first thing Ruth had ever done wrong. Every single night. Without realizing it. Magnesium and calcium share some of the same transport pathways in the gut. When taken at the same time, in large amounts, they can compete with each other for absorption, meaning a magnesium supplement taken alongside a calcium supplement or alongside a large dairy-heavy meal may absorb less efficiently than the same dose taken on its own. This is a smaller effect than the first two mistakes on its own, but stacked on top of poor absorption and reduced uptake from a PI, it becomes the third small thing tipping an already struggling system further in the wrong direction. For someone whose magnesium intake is already on the lower end because of mistakes 1 and 2, mistake 3 can be the difference between a dose that does something and a dose that does almost nothing at all. Ruth had been taking her magnesium and her calcium supplement together at the same moment right before bed for years because it was simply easier to remember as one routine. 2 pills, 1 glass of water, lights out. It made perfect sense as a habit. It made very little sense for absorption. The fix is simple. If you take a separate calcium supplement, take it at a different time of day from your magnesium, ideally several hours apart. Calcium in the morning, magnesium in the evening is a pattern many people find easy to remember and stick to. And if you are taking magnesium specifically for nighttime leg cramps, the evidence and clinical practice both point toward taking it in the evening, generally 200 to 400 milligrams of elemental magnesium, roughly an hour or two before bed, giving it time to be absorbed before the high-risk overnight window we discussed earlier in this series, without taking it so close to lying down that any mild stomach effect disrupts your sleep. And here is what nobody had ever told Ruth in nearly a year of trying. It wasn't that magnesium doesn't work for people like her. It was that she had never once had all three things right at the same time. The form, the medication conversation, and the timing and a year of effort had quietly been undone. 3 small ways, every single night. 3 things to check today. 1. Look at the form on your label. If it says magnesium oxide, you are likely absorbing a small fraction of what the milligram count suggests. Magnesium glycinate is generally the better choice for nightly use and nighttime cramping specifically. Magnesium citrate is a reasonable alternative, particularly if you also deal with occasional constipation. 2. If you take a proton pump inhibitor, especially if you've taken one for a year or more, and especially if you also take a diuretic, ask your doctor whether your magnesium level should be checked. A normal blood test does not rule this out on its own. 3. Take your magnesium a few hours apart from any calcium supplement and in the evening, roughly an hour or two before bed, for the best chance of it being absorbed and in place before the overnight cramp window. Ruth switched her magnesium from oxide to glycinate. She raised the magnesium question with the doctor managing her PPI. And she split her 2 pills apart, calcium in the morning with breakfast, magnesium in the evening, alone, about an hour before bed. None of those 3 changes were dramatic. None of them required a new diagnosis. They required actually looking at a bottle she had trusted for almost a year without ever reading past the word magnesium on the front. If something you've been taking for months hasn't worked, it doesn't always mean it can't work. And it doesn't mean you did anything wrong. Sometimes it simply means nobody ever told you there were 3 different ways to get it right, and you'd quietly been missing all 3. Drop a comment and tell me which form of magnesium is on your label right now, oxide, citrate, or glycinate. I'm genuinely curious how common each one is among everyone watching this, and I read every single comment. If someone you know has said magnesium just doesn't work for them, please send them this video. There's a real chance it's one of these 3 things, and a real chance it's fixable in the next 5 minutes. If there's a topic from your own experience that hasn't been covered yet on this channel, a symptom, a medication, a question your doctor brushed past, tell me in the comments. It shapes what I make next more than almost anything else. Subscribe, and thank you for being here.